This is KTVU Mornings on 2.
All right, October is Talk About Your Medicines month. So we are opening up your medicine cabinet to find ways to save money and maybe your health.
Should you be loyal to a certain pharmacy, and when should you throw things out?
Yeah, for more on the 5 questions you should ask your pharmacist, let's go now to Gassia.
Thanks, you guys. I'm here with San Francisco-based pharmacist Dr. Linda Bernstein. She's here on behalf of FamilyWize. We're talking about being safe and saving money, and you say it all starts with picking the right pharmacy for a number of reasons.
That's right. You want to be loyal to your pharmacy because there's lots of things that they can do for you. For example, they can keep track of all the medicines you're taking, and also they can do a drug interaction screen. They can review the medicines that you're taking, make sure you're not duplicating any medicines, there's nothing expired in your medicine cabinet. You can bring all your medicines into them and do a brown bag session.
Right. And so let's say I've picked my one pharmacy. You say that, you know, insurance or not, there are other ways to save money. I never thought of pharmacy cost as being negotiable in any way.
That's right. It's important to ask about your medicines that you're taking and make sure that you're taking ones that are the least expensive within the category of your insurance. For example, insurance companies have what's called a formulary, which is like a drug list. Some of the medicines, such as generic medications, are less expensive. If you have an opportunity to ask for a generic medication instead of a brand, and that could save you money, that's great.
A lot of controversy, though. Some people say generics aren't as effective as name brand drugs. Where do you fall on that?
That's a myth. Generics they're reviewed by the Food and Drug Administration, and they also are considered equivalent. And there are some products where you would not want to substitute a generic for a brand, but those are rare exceptions. So always ask your pharmacist about that. And there's some great tools that you can ask for that you have on FamilyWize.org, which is a campaign that's going on right now. They have a prescription pricing tool. You can put in your zip code and find out the least expensive price for your medication in your area. They also have a prescription savings card, and they have an ebook which has lots of great information, which I happen to write, that talks about how to use your medication safely, effectively, and save money.
We'll link FamilyWize to KTVU.com. Before I have to let you go, first of all, you're telling me not to put my pills in the bathroom where it's so convenient.
That's right. The medicine cabinet is probably one of the worst places you can store your medicines. It's better to put them in a cool, dark, dry place in the locked cabinet, out of reach of children. Sometimes medications do need to be refrigerated, but even those, you make sure that they're in their original child-proof containers so that kids can't get a hold of them.
And so many people just flush or throw in the trash the unused medication. You want us to be much more careful.
You want to be careful because of the environment and also for poison prevention purposes. So most of the time you can take your medicine, put it in a zip bag, like a plastic bag, and inside of that bag put in some coffee grounds or kitty litter or dirt. Make it very unpalatable for anyone who'd want to try any of the medicines that you've dumped in there. There are a couple of medicines, such as narcotics, that sometimes can be flushed, and those would be desirable because those are very poison if they would be swallowed.
I also know some pharmacies will take back any unused drugs, and there are national drug take-back days by the federal government if you can save them in a safe place and then drop it off to law enforcement. We know they're not getting in the waterways or in your child's body.
Exactly. And check your local pharmacies and see if they have take-back drug days as well. And EA Drug Enforcement Administration has special containers that narcotics could be put into.
Okay. Dr. Linda Bernstein, thank you. Staying safe and saving money. I like them both. Guys?
All right. Thank you, ladies. Great advice there.